Hello, everyone. Welcome to another special webinar from LAM. Today, we are still on floating pulses, and this time we shall be focusing on Soggy Pulse. I don't know if I pronounce it right. Soggy, or soft, weak floating pulse, or rumai. The Soggy Pulse is floating, thin, and soft. It indicates deficiency and dampness. The soggy pulse is due to insufficient qi and blood with depleted vessels. It can also be caused by a dampness pathogen blocking the vessels. So if you have dampness, there is always a possibility that your pulse would be soft or soggy, but it is floating. It is superficial. Some sources term this pulse soft. This pulse image is described in Huang Ti Neijing Suwen as being like a piece of silk thread lying on the surface of water. This is very apt, no? The pulse will be felt superficially. It is without strength, feels narrow when rolling the tips of the fingers back and forth. The pulse will disappear when you press your fingertips downwards. The soggy pulse can be felt when there is qi deficiency and blood deficiency and dampness. Dampness
Mhm.
smother the pulse as if it is wrapped in cotton wool. The qi deficiency and blood deficiency will mean that the pulse doesn't have the strength to be heard through the dampness. So it's the culprit here is actually the dampness. Or you can have, of course, when you have dampness, you can have qi uh, because it impacts the circulation. Okay. So typical combinations would be for damp heat, the pulse would be soggy and rapid. For damp
Mhm.
cold, it's soggy and slow. Okay? So, yun. If you press the pulse, it becomes weaker and weaker. Okay? It is like a strand of cotton floating on the water, feels very thin and indistinct. It is like a bubble which bursts when pressure is slightly increased. So mawawala na, di ba?
Mhm.
So the key points here, soggy is superficial, it is payat, it is thin and forceless. It is also called weak floating or soft. Now let's go to the pathogenesis. If the etiology is dampness, we all know that dampness can impact the vessels. It actually depresses the vessels. Because of the dampness, the qi and blood cannot easily flow. So the pulse would be thin and soft. Okay, it is a deficiency syndrome when you feel a soggy pulse because the yang loses its root when the qi, yin, or blood are deficient. If the pulse disappears when pressed, the yang is expiring. So if the pulse is present in a young or otherwise strong patient, because this is supposed to be for the elderly, no? For the not so young. So if you find this in a young patient or a strong patient, we do not have a good prognosis. Okay? Excessive diseases with deficient pulses do not suggest a good prognosis. Kasi pag excessive diseases, the pulses should be strong or excess, diba? Yun. This pulse appearing after a severe disease or after childbirth indicates that the body has not recovered from the damage to blood and qi. The pulses and symptoms are both deficient, so they go with the current. Okay. The deficiency, however, can be reinforced and treatment is easy. The soft pulse in normal person without any symptoms of severe disease is said to be without root due to failure of kidney and spleen. This must be quickly treated to curtail further development. That is why we should start educating our patients how to check their pulses. So, and I tell you, the patient would love that. And you will have a patient that will stay with you forever. You just have to be very patient with your patient. Okay. Pulse comparison. We should not confuse the soggy pulse with the weak, minute, or thin pulses. The soft or soggy pulse, like the weak pulse, is thin, without strength, but the soft pulse can only be felt at the superficial position. Okay? If it is a weak pulse, it can be felt at the deep position. Okay? So remember the cotton kanina, di ba? So
Mm-hmm.
when you press it, nawawala siya. Okay. But if the pulse is still there, it's soft. So that's deficient pulse or weak pulse. It's not a soggy pulse. Okay. The soft pulse, like the minute pulse, is floating and thin. However, when you increase the pressure, the soft pulse cannot be felt anymore. Whereas the minute pulse doesn't vanish, but becomes intermittently indistinct. The soft pulse, like the thin pulse, is very fine, but the soft pulse can only be felt again, paulit-ulit, at the superficial. The thin pulse can be clearly felt at a sinking position. Okay? Clinical significance. The soft pulse usually indicates damage to the yin blood and severe deficiency of the yin gene. It can appear with deficiency in the sea of marrow, deficiency of the dantian, indeficiency causing night sweats, bone steaming fever, or uterine bleeding. It can also indicate spleen deficiency with inability to control dampness and can therefore appear when dampness is trapped in the spleen, causing soft stools. Okay? So the reason probably why some people will always have soft stools is because of your diet, dampness. When the yang qi is weak and the surface cannot be consolidated, non-stop sweating appears. Remember, spontaneous sweating. And the soft pulse can be felt at the Tsun position. Tsun position is heart and lung, right? Yon. When the stomach and spleen are weak and deficient and the central chi is deficient, the soft pulse can be felt at the Quan position. When the lower heater is cold and deficient and the jing and blood have both been damaged, the soft pulse can be felt at both shear positions. In this case, treat by warming to tonify the true yin, which will discharge the disease. Any reaction? Any question? Or are we ready for the assessment again? Who would like to volunteer?
Maybe
Madam
first.
Tricks.
Yes, Doc.
Okay. Number one, what does the length of a pulse mean?
It means how long the pulse is felt, if it's short or long or in between.
Good. Okay. Rate of pulse, what does it mean?
It means that how many times the pulse beats at a certain time.
Okay. This time, we use the watch, no? Kasi in the past, during those dynasties, diba, they don't have a watch pa. So they would always compare it with the practitioner's breath.
Mhm.
Tension of a pulse.
It refers to the hardness of the blood vessels. Normal or either shouldn't be too taut or too slack
Okay.
as well.
Shape of a pulse.
It means the rising and dropping of the vessels as the blood flows through.
Okay, good. Superficial pulse. What does it mean?
Means of exterior patterns and deficiency pattern.
Okay. Floating. It is distinctly felt. Yeah, you're right. Um, yeah, so we started with the three pulses, puro floating yon, diba? Superficial and then surging, and now we have um the soft or the soggy. And there are like 26 more. Di ba? Deep pulse. What does the deep pulse mean?
It means of an interior syndrome.
Okay. It is felt next to the bone
The bone.
and it is barely felt at upper levels. Next to the bone na siya. Malapit na sa bone. Okay. Slow pulse. How would you describe a slow pulse?
Um, a cold syndrome and the chi deficiency.
Okay.
I'm
Uh,
sorry.
yeah, it's
Uh,
okay. Yeah, it signifies that, no? Cold syndrome or chi, um, yang deficiency. But here, when you say slow pulse, as what I said earlier, in the past, wala pang watch. Um, this is practitioner's breath, but I don't think it's going to be practical because sometimes the practitioner may have shortness of breath.
Yeah.
So if it's 40 to 60 beats per minute, so what we do, take the pulse for 15 seconds and multiply it by 4. Okay. Fast pulse.
um, it means of a heat syndrome, 90 to 140
Yung 90 to 140. Ang
BP.
lakas, ang bilis, no? 5 times per breath. But the rhythm should be regular. Okay.
Uh,
Excess pulse. What do you mean by excess pulse?
excess syndrome of Zong Chi and evil Chi being strong.
Okay. Um, that means it can be felt in all three
Three
locations at all
locations.
three levels. Okay?
Levels. Uh,
All three locations, all three levels, superficial, middle, and deep. Yan ang excess.
excess.
Okay? Um, long, large, forceful, giving it a feeling of fullness. Deficient pulse.
Um, it is of the deficiency syndrome. It's weak and wide in on all three positions.
Yeah, it is forceless in all the depths. Okay, without strength, lack intention. Okay, thank you so much, everyone,
Thank
for
you.
joining. We hope you had fun.
Yes.
And now we're open to questions. So thank you for joining.